Can you just put your hand up if you've voted in that thing that Paul talked about earlier on? Yeah, so a few of you did. I am told that precisely 1% of the people who took part in that poll are here because they want to be inspired by the speakers. So I promise to be as dull and boring as I possibly can be, all right? Apparently you also want some insights. So, hey, let's see. We might maybe manage some insights. Housing associations, the National Housing Federation is the trade body for all of England's housing associations. Collectively, housing associations house about 5.85 million people, or 10% of the population. And one of the things that's interesting about the profile of the residents of housing associations is that we have quite a number of new tenants who are in their 20s and 30s, relatively few in their 40s and 50s, and over half of all tenancy agreements that are held by housing associations have as the tenant someone who is over 60. So that's half of our tenant population, people who are already in their 60s, and who will need, as they become older and more frail, many of them will need some social care, some support, some health care, and almost all of them, as we all know, will want to do that ideally without going anywhere near a hospital. And I was fascinated by the example of integration that we heard from Scotland, and George's really, I thought, thoughtful and fascinating presentation about how you bring different people together and ask them to do things in a different way. Health and social care. It's like a single word, isn't it? Health and social care. And the problem with the single word, health and social care, is that it doesn't leave room for the other important word that should be part of that single phrase, housing, health, and social care. No mention of housing. And I think that we have to do some rethinking, because I still believe that our approach to the delivery of health, certainly, and social care to a certain extent is about going somewhere for it to be delivered to you. And that's not what people want, and it's not generally what they need. It is much more. We are going to have to be much more thoughtful about helping people to continue to live in their own homes and to do so independently, with safety, security, and with connectedness. Certainly one of the things in George's presentation that rang a big bell for me was we need to ensure that we don't isolate people in their own home, but with no connection to anyone else. But this is all part of a mindset, isn't it, that needs some changing. So my guess is that if you ask the population at large, maybe even if we asked you and your people who are involved in the business, what your picture of, what is the picture that conjures up in your mind when you talk about primary health care, you'll probably think of a GP surgery or a clinic or something of that kind. I've had a couple of conversations with Stephen Dorrell about this, who I think is absolutely on the money when he says primary health care is having a decent home to live in. And unless we get our thinking fixed and located in, I think, a reimagining of how we do all of this, then we will continue to be trapped in the tram lines that lead us to a point where someone as senior as David Behan is saying, we have reached a tipping point. Not we're approaching a tipping point, but we have reached a tipping point. That's quite chilling. And the truth is that there's a huge focus on how we manage hospital care and not nearly enough focus on social care. And there hasn't been for a very long time. It's all a bit haphazard. There are some people doing absolutely fabulous work, actually including many housing associations. But they're kind of doing it sporadically in different places. What we keep seeing is brilliant individual projects that never turn into programs. not far from here, Midland Heart Housing Association has worked with a foundation trust, a hospital trust, to say we'll build a facility that allows people who have no clinical or acute need to be in hospital to come and live for the period that's necessary in a kind of care facility that they, Midland Heart, manage. That's worked extremely well. It's a very obvious thing to do. Why are there not 500 such facilities around the country? And to get to that point, we have to think about different partnerships and different approaches to doing things. So one of my obsessions for a long time has been the relationship between housing associations and foundation trusts, hospital trusts, community health trusts, mental health trusts. We should not be in an environment where there's an occasional incursion from one world to the other that occasionally collides and produces one really good project. We have to think much, much more about genuine long-term strategic partnerships. So if you're running a big hospital, you've almost certainly got land and property that you're not presently using. So we say to them, you've got land and property that you're not presently using. Can we buy it? And there's always a bit of a hesitation to sell it. Why is there a hesitation to sell it? Well, mainly because it's a capital asset. If you dispose of a capital asset, the benefit's mainly going to go back to the Treasury. And in any event, if you hold on to it, hope value, it might become more valuable in the future. And in any event, what hospitals are looking for is revenue streams, not a capital transfer. Okay, so we can solve that problem easily. Really, we can help to solve that problem. Don't sell us the land. Lease it. Lease it for 50 years. Lo and behold, you've got a 50-year revenue stream. And de facto, you have a relationship between the housing association that you've entered the lease agreement with and that foundation trust, that trust. And then you can begin a conversation that says, so how can we do things together that work for both of us? So you might say, we will build on this land something that will help you not to have to keep people in hospital who have no clinical or acute need to be there. We might build on this some homes for shared ownership for some of the people who work in your hospital. We might build on it some good quality homes for people who just need a general needs home at an affordable rent, which is absolutely critical to having a healthy nation. And then you've created a partnership from which all kinds of other things can follow. I made this proposition at an event that we ran a couple of years ago at the King's Fund that had health people and housing people in the room, and someone who ought to have known better, who used to run the NHS PropCo, who after hearing all of this said, sounds great, it'll never happen. Why will it never happen? Because the FDs in foundation trusts won't know how to account for it. And he was trying to make a joke, but it did strike me that there's more than a modicum of truth in that, isn't there? That we all get trapped in the way that we do things, and that we need to think of different ways of making the connection. Care, homes, communities, making them all connected. Now, this event is obviously based on the technology that can be offered to help things to work better. That's fair, proper, and absolutely essential, because there is vast potential in using technology, in using digital technology. But here's the challenge that I think we've got. This is not universally true, but in my view, and I'm way off my subject, I have no expertise in this at all, but in my view, what I observe, certainly in our sector and where we engage with health and other people in the social care world, is that what we have a tendency to do is to say, this is the way we do this. We have a series of processes in place. We understand that using technology or using different digital platforms might create an environment where it's possible for us to do those same things better, more efficiently, more effectively. That's a good thing. But it's not the great thing. The great thing is to reimagine, is to say, is there a different way that we can do this all together? And imagine what that good, different way would be, and then say, can we construct or commission a technological solution that will help us to deliver it? You have to start with the imagining, with the creating, with thinking differently about how we do things. And that's a big challenge, and it's scary. But if we are to go anywhere near meeting the challenge, I was visiting a place called Lench's Trust in Birmingham. I'm going to stop in a minute because I'll run out of time, but visiting a place called Lench's Trust. Lench's Trust was created by a guy called William Lench in 1525. So it's been around for 491 years and has been providing housing for older people in one form or another, mainly through almshouses, but now much more sophisticated, for all of that time. And they were opening a new development. And one of the things that I was talking to a couple of the people who were living there about was, have we got our heads round this? I think a reality now, but absolutely will become an even greater reality in the future. The reality of people in their 70s possibly living in some kind of specialist accommodation for older people who are still looking after their frail elderly parents. Have we really come anywhere near to considering what the consequences of that are and how we think strategically about how we respond to that? Molly earlier gave us a fantastic demonstration of how, by thinking differently and then commissioning the technology, you can do things differently. Right across the board, this has to be the challenge. The challenge for all of us, if we are to make the fundamental difference that we need, if we are to have any chance of putting in place the social care support mechanisms that people will need as they become older and more frail in their own homes, we are all going to have to take a big step back from the vested interests and the way that we do things now and start from a place of imagining a future that's better than the present, crafting that, creating it, and then saying, if that's what good will look like in 5 or 10 years' time, if that's what we really want the world, this world, to look like in 5 or 10 years' time, what do we have to do now to start on the process of delivering it? Rather than, what are we doing now? How can we make it marginally better? I think that there are two things that are central to that. The first is having a much more profound understanding of the capability of a fantastically changing digital and technological world. Way outside my comfort zone, but I am completely convinced of the potential that sits there. And the other, as George said earlier on, the other is leadership. Leadership does not just come from David Behan or ministers or the people who are running NHS England. Leadership comes from every housing association, every hospital trust, every mental health trust. We all have a role to play in our own areas of imagining a future differently and then seeing how we can go about the process of constructing it. Thank you very much.